Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mr. Virat. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Virat. I'm Dr. Helen, the gastroenterologist. I understand you're experiencing some troubling symptoms?
Yes, good morning, Dr. Helen. I'm feeling terrible, honestly. I've been having constant nausea, and I've barely eaten in 2 days.
I'm sorry to hear that. Let's take a closer look at what's been going on. Can you tell me a bit more about when your symptoms started?
Well, I felt fine until the day before yesterday. We went out for dinner that night, and just a few hours after eating I started feeling queasy. Since then, it's only gotten worse.
I see. Was there anything specific you ate that seemed off or unusual?
Not really, but I did have a seafood salad. It tasted fine, but I remember it seemed slightly warmer than usual, almost like it hadn't been kept chilled properly.
Thank you, that's helpful. Based on what you've described, it's possible this could be a case of food poisoning. Likely from something in that salad. It can happen if food isn't stored or prepared correctly, particularly with seafood.
Oh no. I thought food poisoning would just cause a bit of an upset stomach. I didn't expect it to be this intense.
Yes, it can range from mild to severe. It sounds like your body is reacting quite strongly. Aside from nausea, have you had any other symptoms like vomiting, fever, or stomach cramps?
Yes, I've had all of that. I threw up several times yesterday and had some intense stomach pain. I also felt feverish last night, though I didn't take my temperature.
Thank you for sharing that. Fever, vomiting, and cramps are common signs of food poisoning, especially if it involves bacteria like Salmonella or E. coli, which are sometimes found in improperly stored or prepared seafood.
Is that serious? Should I be worried?
Most cases are manageable, but they can sometimes become serious if they lead to dehydration or if the bacteria are particularly strong. From what you've described, it sounds like your symptoms could be managed with supportive care, but I'll want to assess a few more things. Are you still experiencing diarrhea or any blood in your stools?
Yes, I've had some diarrhea, though it's been less frequent today. No blood, thankfully.
That's good to know. Diarrhea is common in food poisoning and can help flush the infection out of your system. However, it can lead to dehydration, especially if it continues without enough fluid replacement. Have you been able to drink any water or fluids?
I've been trying, but even small sips make me feel nauseous again. I'm worried about drinking too much at once.
That's understandable. Taking small sips frequently is actually a good approach. You could also try rehydration solutions which contain electrolytes to help balance the minerals your body loses during vomiting and diarrhea.
I'll try that. How long do these symptoms usually last?
Typically, most cases of bacterial food poisoning resolve within a few days, though mild nausea and fatigue can linger. If symptoms last longer than a week or worsen significantly, it would be wise to come back. Severe or persistent cases sometimes require antibiotics, but we generally try to let the body handle it naturally first.
So, no antibiotics right now?
Correct. Antibiotics are only used for specific types of bacterial infections, and overuse can sometimes lead to resistance or worsen symptoms. For now, hydration and rest are the primary treatments.
That makes sense. Is there anything I can do to help with the nausea?
Absolutely. You could try consuming ginger or mint tea, which can help soothe nausea. Avoid fatty, spicy, or rich foods for now. When you feel ready to eat, start with bland, easy-to-digest options like toast, rice, or bananas.
Okay, I'll try that. Is there any way to know for sure that it was food poisoning from the seafood?
We can't confirm without specific tests, but based on the timing and your symptoms, it's a strong possibility. Food poisoning from seafood, especially if it's not properly chilled, can often cause these kinds of symptoms. If the symptoms continue beyond a typical duration or worsen, we might consider stool tests to identify the specific bacteria or virus.
Got it. So just to be clear, I should focus on hydration, rest, and eat bland foods. And come back if it doesn't get better.
That's exactly right. And remember, small, frequent sips of water or an electrolyte drink are crucial. Avoid alcohol, caffeine, and sugary drinks, as they can further dehydrate you.
Thanks, Dr. Helen. I was worried it might be something more serious. It's good to know it's manageable.
You're very welcome, Mr. Virat. If anything changes or you feel worse, don't hesitate to reach out. We'll be here to help.
Thank you so much. I feel a lot better knowing what to do.
Extract 2. Questions 13 to 24. You hear an endocrinologist talking to a patient called Rachel Turner. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, come on in. It's good to meet you, Rachel, though I know these circumstances aren't ideal.
Thank you. It's nice to meet you too. I hope you can help me make sense of everything. It's been overwhelming since I found out about the lump in my neck.
Absolutely. Let's take a few minutes to go over what's happened so far and talk about any concerns you might have. Your records indicate that you initially went to your GP after noticing a small lump near your throat. Is that right?
Yes, that's right. I noticed it a couple of months ago. It didn't hurt, so I thought maybe it was nothing. But then it seemed to get bigger. I didn't think much of it until my GP suggested an ultrasound.
It's good that you decided to follow up with your doctor. Swellings in the neck can have various causes, so imaging and tests are important steps. The ultrasound results show a nodule on your thyroid gland, which led to the recommendation for a fine needle aspiration biopsy.
Yes, I remember. That procedure wasn't as bad as I thought it would be, but the results, they're hard to process. My GP mentioned something about suspicious cells.
I understand, and that's completely natural. Let's break down what the findings mean. When we see certain cell types in the biopsy, it can indicate that the thyroid nodule may be malignant, meaning there is a chance of cancer. But it's worth noting that the majority of thyroid nodules are benign. However, in cases where cells appear suspicious, further investigation is essential.
So, I might have thyroid cancer?
That is a possibility, yes. Thyroid cancer is a type of cancer affecting the thyroid gland, which is located at the front of your neck. Fortunately, many types of thyroid cancer are treatable, especially when detected early. The most common types are called papillary and follicular thyroid cancers, and both have high survival rates.
I've never really thought much about my thyroid before. I know it has something to do with metabolism.
Yes, you're right. The thyroid gland produces hormones that regulate your body's metabolism, energy levels, and overall functioning. When the thyroid is affected by nodules or growths, it can sometimes impact hormone production, though many people with thyroid cancer do not experience any changes in hormone levels initially.
So, what happens next? Are there other tests you recommend?
Given the biopsy results, I'd recommend a couple more steps to confirm the diagnosis. First, I'll order blood tests to assess your thyroid hormone levels and check for markers like thyroglobulin, which can provide insight into the nodule's nature. Then, we may consider additional imaging, like a CT scan or MRI, to get a clearer picture of the size and spread of the nodule.
Does this mean I need surgery?
If the nodule is found to be malignant, surgery to remove part or all of the thyroid gland is generally the main treatment. Removing the thyroid, or a portion of it, reduces the chance of the cancer spreading. The good news is that thyroid cancer often has excellent treatment options and outcomes, especially with timely intervention.
And if I have my thyroid removed, how would that affect me? Would I need medication?
Yes, after a thyroidectomy, most patients take thyroid hormone replacement therapy. This medication would take over the role of your thyroid hormones, maintaining your body's metabolism and energy balance. It's taken as a pill each day and closely monitored to ensure your levels stay within a healthy range.
Okay, I think I understand. And what about risks? Are there side effects from the surgery?
That's a good question. Thyroid surgery is generally safe, but like any procedure, it comes with some risks, such as infection, bleeding, or changes to the parathyroid glands, which regulate calcium. Another potential risk is damage to the vocal cords, though it's uncommon. If we move forward with surgery, the surgical team will take every precaution to minimize these risks.
It sounds a bit scary, but I know I need to take this seriously.
That's a normal response. It's always a lot to absorb, but the important thing to remember is that we have time to take this one step at a time, and you have support throughout.
Thank you. So, I just continue as normal until these tests are done?
Exactly. There's no need to make immediate changes to your routine. We'll proceed with the blood tests and imaging to get a complete picture of your thyroid health. After that, we'll meet again to review the results and discuss any next steps.
Thank you. I appreciate you explaining everything. It makes me feel a bit better about what's ahead.
You're very welcome. I'll make sure you're well prepared at every stage. Now, I'll set you up for the tests, and we'll keep moving forward as a team.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a senior researcher providing guidance to a junior researcher. Now read the question.
There are some fascinating areas to explore, aren't there? But you took some time to decide which topic you wanted to focus on. So, what does that suggest about preparing for this kind of research?
I guess I need to review current research trends in advance.
Exactly. And of course, with fields like telemedicine and AI evolving so quickly, you need to know how recent the studies are before you dive in. It'd be nice if there were more centralized resources for this.
Should I look into just one of these areas, or try to compare several?
Either approach is fine as long as it's thorough.
Now look at question 26. You hear a medical professional explaining effects of climate change. Now read the question.
Loss are severely affecting various species, particularly those with specific environmental needs. Some animals are forced to migrate or adapt to new habitats, which can lead to increased stress and vulnerability to disease. One prominent case is coral reefs, where warming seas have caused widespread coral bleaching, devastating marine ecosystems and the species that rely on them. In addition, changes in weather patterns are expanding the range of disease-carrying insects, exposing animals in previously unaffected regions to new health threats. This trend is particularly concerning for species already at risk due to limited habitat. Researchers continue to study species and ecosystems that are most vulnerable to these climate-induced health issues to better understand and address the challenges they face.
Now look at question 27. You hear a nurse talking to another nurse about the discharge of a patient. Now read the question. Kevin, can I speak to you for a moment?
Sure, what's on your mind?
I noticed you seem to be a bit distant with the patient in room 12, the one recovering from substance abuse. He's due to be discharged soon, and I think he could really benefit from some counseling before he leaves. But it looks like it's challenging for you to connect with him.
I know, but honestly, I feel like he brought this on himself. It's hard for me to sympathize with someone who made so many harmful choices.
Remember, we are here to support our patients in recovery, not to judge them. People dealing with substance abuse deserve compassion, not blame. Think about how you would want a loved one in his situation to be treated, with understanding rather than stigma. Now look at question 28. You hear a doctor briefing about a patient. Now read the question.
All right, we have a patient who was admitted last night after arriving at the A and E with symptoms of persistent nausea, vomiting, and altered consciousness. Initial assessment suggested dehydration, rapid breathing, and a fruity odor on the breath, which raised concerns for diabetic ketoacidosis, or DKA. Lab tests so far show a significantly elevated blood glucose level, high ketones in the blood and urine, and an acidic pH on arterial blood gas analysis, all pointing towards a diagnosis of DKA. However, additional tests are needed, including electrolyte levels and renal function tests, to further assess the severity and guide treatment adjustments.
Now look at question 29. You hear a patient talking to a dental receptionist about teeth whitening. Now, read the question.
Hi, I wanted to ask about teeth whitening options. I'm hoping to make an appointment to discuss it.
Of course. Have you had any whitening treatments with us before?
No, but I'm interested in finding a method that won't harm my enamel. I've read about a few options, but want to be sure I'm not choosing something too harsh.
I understand. Some of the treatments we offer use gentle formulas specifically to protect enamel. Are you considering in-office treatments, or are you open to take-home kits?
I'd prefer an in-office treatment, just to be safe. But I've heard that some methods can make teeth more sensitive, and I'd rather avoid that.
Well, Dr. Patel specializes in enamel-safe whitening. He could go over all your options and suggest the gentlest approach.
That sounds great. Do you have an available slot with Dr. Patel soon?
Yes. We can fit you in this Friday afternoon.
Perfect. Thanks. I'll see you then.
Now look at question 30. You hear a junior therapist asking his senior colleague about using aromatherapy for a patient with anxiety. Now, read the question.
Scheduled for any aromatherapy sessions this week, but I wasn't sure if I should ask about it because she looked quite distressed this morning. Is it because her anxiety symptoms have worsened?
Well, sometimes we delay aromatherapy if a patient has heightened symptoms, but that's not the case here. Ms. Williams was actually started on aromatherapy sessions last week, but she mentioned this morning that it made her feel dizzy and lightheaded. Until we've assessed the reason for that, it could be a reaction to the specific oils. For example, we're supporting her anxiety management with breathing exercises and guided meditation instead.
Oh, I see.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear a doctor giving a detailed presentation on eczema. You now have 90 seconds to read questions.
Hello everyone, and thank you for joining me today. I'm here to present some of the latest research being conducted by the Skin Health Research Institute on managing eczema in children. Eczema, or atopic dermatitis, is one of the most common chronic skin conditions affecting children, and it causes a range of symptoms including dry, itchy, and inflamed skin. This can be a significant challenge for children and families, impacting sleep, school performance, and overall quality of life. Recent statistics indicate that approximately 10% of children worldwide are affected by eczema, with the highest rates in developed countries. In the UK, eczema affects around 1 in 5 children under the age of 12, while in the United States it is estimated to affect nearly 13% of children. The exact cause of eczema remains unclear, but we know that it is influenced by a combination of genetic, environmental, and immune factors. Additionally, recent studies suggest a connection between eczema and other conditions such as asthma and allergies, which we will take into account in our trials. The Skin Health Research Institute is currently initiating 2 new studies to evaluate both topical and oral treatments that may help manage eczema symptoms in children more effectively. The first study will explore a topical ointment containing an ingredient called biomimetic lipids. These lipids are similar to the natural lipids found in the skin and are designed to improve the skin barrier function, which is often compromised in children with eczema. By strengthening the skin barrier, the aim is to reduce the dryness and inflammation associated with the condition. The topical treatment will be applied twice daily, and researchers hope to observe a significant improvement in skin hydration and reduced itchiness over a 6-month period. Children participating in this topical treatment study will be split into 2 groups, one receiving the active ointment with biomimetic lipids, and the other receiving a placebo ointment.
To ensure the safety of the participants, parents and caregivers will be asked to monitor their child's skin condition and report any adverse reactions. Additionally, the research team will conduct monthly check-ins, either in person or via a virtual platform, to document the progress of the treatment. Our second study will assess the effectiveness of a new oral supplement containing probiotics and omega-3 fatty acids. Both of these ingredients have been studied for their potential to support skin health, reduce inflammation, and improve the immune response, which may play a role in reducing eczema symptoms. Unlike the topical ointment, which directly targets the skin, this oral supplement aims to improve skin health from within by balancing gut bacteria and boosting anti-inflammatory processes in the body. Children enrolled in this study will take the supplement once daily, and the study will continue for a duration of 1 year to allow time to assess any longer-term benefits. One of the main objectives of these trials is to understand whether these treatments can help reduce the need for steroid creams and other medications often used to manage eczema. Steroids, while effective, can lead to side effects, especially when used long-term, and some parents are concerned about their children relying on them indefinitely. Additionally, for many parents, the link between diet and eczema is an area of interest. Recent research has suggested that certain dietary changes, such as reducing sugar intake and increasing omega-3s, may contribute to fewer flare-ups, though more evidence is needed to make specific recommendations. To support parents in managing their children's eczema, a subset of families involved in the study will receive dietary counseling to help them identify foods that may potentially reduce symptoms. Although the connection between diet and eczema is still being studied, the hope is that including dietary guidance alongside topical and oral treatments may offer a more comprehensive approach to managing the condition. It's also important to mention that these studies are guided by a focus on minimizing the discomfort and anxiety that can come with participating in clinical trials. Children will have the option to withdraw from the study at any time, and each family will be closely supported by the research team, including access to a nurse available for any questions or concerns. If successful, these studies may not only provide new, effective treatments for childhood eczema, but also encourage a more holistic approach that includes lifestyle and dietary modifications. To summarize, our clinical trials will assess the efficacy of a topical ointment with biomimetic lipids and an oral supplement with probiotics and omega-3s. We hope that these treatments will offer children an alternative, or complement to steroid creams, potentially reducing flare-ups and providing better long-term control of symptoms. Thank you all for your attention, and I look forward to sharing our progress as these studies unfold.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Eleanor Marks, an expert in environmental health. Now, read the questions. You now have 90 seconds to read questions.
Hello everyone,
and thank you for joining us in this session on sustainable practices in healthcare. Today I'm joined by Dr. Eleanor Marks, an expert in environmental health, who has recently completed a comprehensive study on waste management in healthcare settings. Please join me in welcoming Dr. Marks to the stage.
Thank you so much for that warm welcome. I'm really excited to share some of the insights we've gathered on this essential but often overlooked topic.
So, Dr. Marks, tell us a bit about what led you and your team to focus on medical waste management.
Well, healthcare facilities generate substantial amounts of waste daily, ranging from plastic packaging to hazardous biomedical waste. We realized there was a gap in research specifically addressing sustainable practices in these settings. Waste in healthcare isn't just about disposal, it impacts the environment, and there's a direct correlation with healthcare costs. We wanted to develop effective, low-cost strategies to reduce waste while ensuring safe and sustainable practices across various facilities.
That sounds like a really important area of study. So, what were some of the strategies your team investigated?
We focused on three main areas: reducing single-use items, improving recycling programs, and implementing eco-friendly disposal methods. In the case of single-use items, we encouraged facilities to substitute certain disposable items with reusable ones where feasible. For recycling, we collaborated with waste management providers to educate healthcare workers on proper waste segregation so recyclable items weren't contaminated. Lastly, we explored safer disposal techniques for hazardous waste that don't involve incineration, which is a significant pollutant.
Did you conduct this study within a particular type of healthcare facility, or was it more widespread?
We worked with a diverse group of facilities, from large hospitals to smaller outpatient clinics across several regions. This approach allowed us to see how different settings could adapt these strategies, as some methods that work in larger hospitals may not be feasible in smaller clinics. In total, 22 healthcare facilities participated in this study, which spanned over 3 years.
That's impressive. And did you see any measurable results in terms of waste reduction?
Absolutely. We saw promising results, especially in recycling. On average, the facilities reduced their general waste by nearly 30%. Our data showed that implementing a structured recycling program and reducing single-use items in non-critical areas can make a big difference. Additionally, some facilities adopted a green disposal method that minimizes the release of harmful chemicals, which reduced hazardous waste by around 15%.
What kind of feedback did you receive from the healthcare staff involved in these changes?
Initially, some staff members were skeptical about the effectiveness and practicality of the measures, particularly regarding reusable items. However, after observing the impact and simplicity of the changes, most staff became advocates. Education and training were key, ensuring they understood the environmental impact and the cost benefits for their facility.
That's encouraging to hear. What's the potential long-term impact of these waste reduction practices?
In the long term, reducing waste could significantly lower healthcare costs while protecting the environment. We're talking about cost savings that could be redirected towards patient care. More importantly, these practices set a positive example for sustainability in other sectors. By adopting these strategies, healthcare can lead the way in environmental responsibility.
Do you have any follow-up research planned to expand on these findings?
Yes, we're looking into adapting these strategies for different geographic regions, with varying regulations on medical waste. We also aim to examine the environmental impact more closely, such as measuring carbon emissions and assessing the full life cycle of medical supplies. These insights could help us develop even more efficient waste management practices tailored to different healthcare settings.
It sounds like there's still a lot to explore. Thank you, Dr. Marks, for sharing your team's work with us. These efforts in sustainable healthcare practices are truly inspiring.
Thank you, and I appreciate the opportunity to talk about this important topic. I look forward to seeing how healthcare facilities continue to adopt these sustainable practices.
That is the end of Part C. You now have 2 minutes to check your answers.